Imagine a heart with only one ventricle doing all the work. This is the reality for children with single ventricle defects. Let's explore how these conditions challenge the heart's normal function. Common types include hypoplastic left heart syndrome and tricuspid atresia. These conditions create a parallel circulation, unlike the typical series circulation, demanding unique medical approaches. Single ventricle defects occur in 1 out of every 4,000 to 5,000 births. Despite their rarity, they represent some of the most critical cases in pediatric care. Thanks to surgical advancements, survival rates have improved significantly. However, the highest risk remains during the initial Norwood procedure. Before the 1980s, these conditions were untreatable. Dr. Fontane's innovative approach in the 1970s paved the way for modern surgical interventions. The 3-stage surgical approach has evolved, offering hope and improved outcomes for affected children and their families. Stage 1, the Norwood procedure, is performed shortly after birth. It reconstructs the heart's plumbing, setting the stage for future surgeries. Stage 2, the Glenn or Hemi-Fontan, occurs at 4 to 6 months. It reduces the heart's workload, improving oxygenation and preparing for the final stage. Stage 3, the Fontan completion, happens between ages 2 to 4. It separates systemic and pulmonary circulations, enhancing oxygen levels but requiring lifelong follow-up. Newborns often present with severe cyanosis and poor feeding. Immediate intervention is crucial to stabilize them for surgery. Between stages, chronic cyanosis and limited exercise tolerance are common. Parents become adept at recognizing their child's baseline health. Post-Fontan, patients show improved oxygen levels but face potential complications. Lifelong monitoring is essential to manage risks. Balancing systemic and pulmonary blood flow is key. Each stage has specific oxygen saturation targets to guide care. Fluid management is critical. These patients are preload dependent but prone to overload, requiring careful monitoring and medication. Understanding each stage's physiology is vital. Subtle changes in a patient's condition can signal deterioration, necessitating prompt action. Families are invaluable partners in care. By supporting them, we enhance patient outcomes and foster a collaborative care environment.